Hi, I'm Amber Krause, and I'm going to be talking about some mental health disorders that we've kind of gone over in the past. Um, so, some of these most common ones are anxiety disorders, mood disorders, which include depression and bipolar disorder, and schizophrenia. So, those are the ones that I'm kind of going to go over and talk more about. First off, anxiety disorders. These are considered to be the most common psych disorder in the US, characterized by excessive worrying over everyday occurrences that people normally would not worry about, people in the general population wouldn't worry about on a daily basis. This worrying can be sometimes impossible to control. Some of the symptoms that you'd assess in a patient with anxiety are restlessness, being easily fatigued, difficulty concentrating, irritability, muscle tension, sleep disturbances. So in order to, diagnose this or diagnose someone with anxiety disorder, those symptoms need to occur on the majority of days for at least a 6-month duration. The patho of anxiety is not entirely known. People with anxiety disorders, they can develop that anxiety without any real triggers or anything. Or they can occur in response to environmental stressors, such as the loss of a loved one or stress at work, maybe a new job. The link between anxiety and decreased serotonin levels have been shown, so that's, possible cause. Treatment for anxiety can include counseling, cognitive behavioral therapy, or medications. Typically, people with anxiety will be put on an antidepressant, usually an SSRI or a benzodiazepine. With any medication, it should be evaluated after a few months because it does take a while for these medications to start working. And at that point, if it's not working, they may consider switching medications or dosing if need be. So, nursing considerations for anxiety, it's important to develop a trusting relationship. You want to help them, come up with effective strategies to cope with anxiety, or refer them to, a psychiatrist that can help them where they're. You want to reassure the person that anxiety is a real medical condition. And of course, supporting self-care activities. You want them to be as functional as possible. The next one is depression. So depression affects more than 15 million adults in the US, and it's actually the leading cause of disability in the US for individuals between 15 and 44 years of age. Some of the main symptoms you'll see with depression are difficulty sleeping, loss of interest in activities, feelings of guilt, loss of energy, poor concentration, psychomotor agitation, changes in appetite, and suicidal ideations. For diagnosis, the main two that you're going to look at are diminished mood and depressed mood and diminished interest. So the depressed mood would occur for most of the day, nearly every day, and diminished interest or pleasure in all or almost all activities for most of the day, nearly every day. Again, the patho isn't clearly defined, but there's been evidence that shows there's complex interactions between neurotransmitters and their availability and receptor regulation and sensitivity. And similar to anxiety, there is a link between low levels of serotonin and depression. Treatment for depression often includes talk therapy or counseling of some kind. There's quite a few medications that people can try, including SSRIs, SNRIs, atypical antidepressants, tricyclic antidepressants, MAOIs. And those, again, should be evaluated after a few months to see if there needs to be any changes. Some nursing considerations for a depressed patient, they are at risk for suicide, so you want to just constantly be assessing that, asking them if they have a plan, if they, have the means to carry it out, things like that. You can educate about depression, make sure they understand all of the signs and symptoms and kind of like the treatment options and everything. And then you want to try to plan activities for times when their energy levels are at the peak. So the next one is bipolar disorder. This is a mood disorder characterized by periods of profound depression that alternate with periods of excessive elation and irritable moods, and that's known as mania. So it's that switch between a period of depression and then a period of mania, which mania, some of the symptoms include racing thoughts, pressured speech, irritability, distractibility, thoughts of grandiosity, appetite changes with weight loss, erratic, uninhibited behavior. So with the weight loss thing, that's typically because they have so much energy that they're constantly just going, and they often do forget to eat. And typically, they'll experience these extreme mood swings that interfere with relationships, their job, and just normal everyday activities. It kind of makes it hard to function just in everyday life. The patho, again, like all of the kind of mental health disorders, there isn't, it hasn't been, definitively determined. However, with bipolar disorder, based on twin, family, and adoption studies, there has been shown that there's a significant genetic component. First degree relatives of a person with bipolar disorder are actually 7 times more likely to develop bipolar disorder than the rest of the population. So that's kind of shows a huge link between, in the role genetics play in this. Treatment for bipolar disorder, often psychotherapy is one way to, kind of talk through it with a therapist. Medications that are often used are anxiolytics, mood stabilizers, and antipsychotics. Typically, mood stabilizers is the one that they'll try first, and then, after a few months, check the effectiveness. The dose may be changed, and medication may need to be changed as well. Nursing considerations. Kind of the big one is providing safety and assessing for suicidal ideations, because when they're in the depressed mood, they often do have those suicidal ideations, but they don't have the energy to carry out their plan. So then when they go into this manic state, they all of a sudden have that energy, so they're at a very high risk of actually going through with it at that point. So it's really important for, as nurses or anyone around them, to really provide that safety and make sure they don't do anything to hurt themselves. Providing on-the-go snacks is another thing, because when they're in that manic state, they are constantly on the go. They often forget to eat, so providing on-the-go snacks like cheese sticks or like little baggies of snacks, whatever it may be, is a really good way to make sure that they're eating and they're not just, losing weight. Schizophrenia is the next one I'm going to talk about. This is a chronic and severe disorder characterized by psychotic symptoms that greatly affect how the person feels, thinks, behaves, and perceives reality. The symptoms are delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, and negative symptoms. Auditory hallucinations and delusions are the 2 typical hallmark signs of schizophrenia. That's are kind of the things you think of when you think about the disorder. And with any of these mental health disorders, there is a stigma associated. However, with schizophrenia in particular, the behaviors are often so bizarre that it can be frightening for people around them. In order to diagnose schizophrenia in a person, they must have 2 or more of those symptoms occurring persistently. So the patho involves, dysregulation of multiple pathways. The dopamine, glutamine, epinephrine, norepinephrine, and GABA neurotransmitter systems are the ones that are usually effective. It's also been found that inflammation can play a role in the exacerbation of the psychotic symptoms that you see in schizophrenia. As for treatment, there's psychosocial therapy, electroconvulsive therapy, and medications. The medications don't really treat all the symptoms typically, but it will help prevent relapse of some of the more acute symptoms. Nursing consideration, it's really important to establish trust because a lot of times patients with schizophrenia, they do have a hard time trusting people as they're often paranoid. You want to maximize the level of functioning, promote social skills, and of course always want to ensure safety. Sometimes these patients may have thoughts of hurting themselves or hurting someone else, so it's really important to be monitoring them and make sure they're not going to hurt anyone or hurt themselves. Another thing you can do is when they're having those hallucinations, you don't want to argue with them or anything, tell them that they're wrong, but you do want to like kind of try to bring them back to reality and make sure they know that, you know, you're not hearing them and that, you know, they're not real, they're not really there. But just supporting the patients, ensuring safety are always important aspects. And that's all I got. Here are my references. Thank you.